Hi, Dr. Applin here, and today's article is about chiropractic and physical therapy treatment for cyclists. And when we're working with athletes, each type of sport has its own unique set of conditions that are usually associated with it. For example, runners classically get knee pain. Someone who's a swimmer or a baseball player will classically get shoulder pain. With the cyclist, it's typically one of two things. So we're usually going to see hip pain associated with cycling, or we're typically going to see lower back pain associated with cycling. And those two conditions are brought on by two very different things. So the hip pain is typically caused simply by wear and tear, repetitive stress over time. I mean, you're spinning those wheels, you're pushing the bike with your hips constantly, repetitively for, dozens and even hundreds of miles depending on the cyclist. And over time, it creates friction in the joint. The joint starts to wear down, and it causes internal damage. That's what repetitive stress is. For the lower back, you're in this hunched over position on your bike, and you can have the best seat in the world, you can have the most ergonomically correct bike on the planet. It doesn't change the fact that you are in that flexed forward position for long periods of time. And classically, a flexed forward position is not very healthy for your lower back. The reason being, you have these little discs. There we go. You have these little discs that act as shock absorbers for the spine. And when you're leaning forward, what happens is it compresses the front part of the disc, and it creates this bulge in the back part of the disc. Now, the disc is very weak in that position, and it makes you more prone to a disc sprain, a disc bulge, or even a disc herniation over long periods of time. So if you're a cyclist and you're experiencing any of these conditions, don't hesitate to give our office a call. But first, go ahead and read through the article. I hope it's informational. Thank you.